All right, guys, happy Friday or Saturday, depending on when you watch this. I'm just doing our weekly review. I really liked the discussion board this week. I think I probably learned more about it than you guys because you have more exposure than I do. But it's just something that fascinates me, and I'm hoping to go to continuing ed and learn a little bit more about the restricted blood flow. I do have a little bit of continuing ed, so this is not my stuff. I was trying to look for the author of who I took this continuing ed from. It was just one I did online and I did not find it, but just know that this is not my information, that it is from continuing ed that I took, okay? So part of it, and you guys might know some of this, so I apologize that if it is a repeat of what you already know. So it just talks about, first off, what the goals, and the goals is we want to create that anaerobic environment. And one of the things that I actually questioned you guys about was, what muscle fibers are we targeting? And this one says that we want to stress the type 2 muscle fibers to prevent that atrophy, which is kind of what I was thinking, but I wasn't exactly 100% sure on that. So there again, even as you are graduated, you have to learn and you have to continue to grow. It also talks about how it gets into the pituitary and the release of the growth hormone that is going to help to prevent some of that atrophy that occurs. So let's see. So they found that in their studies, again, I don't have the study to quote, but it says that in the study, the first week after injury, they had a 30% decrease in protein synthesis and a 30% decrease in strength. And so in the subacute, they could add low intensity exercises, and the multi-joint metabolic buildup increased in the growth hormone and the lactic acid. So they are talking that the lactic acid actually helps and is a good thing, but it makes sense because if we have more lactic acid, usually it can mean that the muscle is working more, so that's a good thing. So some of the precautions that they have listed. So these are the precautions. Patients with poor circulatory system, and that one you guys kind of hit on. Arterial calcifications, makes perfect sense. Abnormal clotting times, makes sense. Diabetes, and that's one I kind of threw out there to you at the end. My dad's a diabetic, so it's something I'm kind of passionate about, and I just know that the microvascular is not always great in diabetics, so we gotta watch how much we want to occlude. Sickle cell trait, tumor, general infection, hypertension, which you guys hit on as well, CP conditions, renal compromise, acid-base imbalance, arteriosclerotic vessels, again, all these make sense, in patients who are taking antihypertensive or creatine supplements. The creatine was something that I didn't even think of. I'm not sure on the rationale behind that, but that's just one of them it has listed. Absolute contraindications, and you guys said this: venous thrombosis, impaired circulation and vascular compromise, acidosis, sickle cell anemia, extremity infection, a tumor, meds that increase the clotting risk. So there again, we even have to think about our ibuprofens and our NSAIDs because they mess with that stuff. Open fracture, soft tissue injury, severe crushing injury, severe hypertension, severe elbow swelling after joint surgery. So that's one of them that I'm like, oh, okay. Vascular grafting and cancer. So a lot of those, again, common sense, you're going to know that, okay? So it talks about how the blood flow restriction can decrease the atrophy. And again, it talks about the increase in the lactic acid because we have the pituitary gland is, it called it tickled. The pituitary gland is tickled. And, but the good thing about that is then it releases the growth hormone. So it was 290%, which isn't really a right percent, but 290% higher than baseline, the growth hormone release was. Okay, this was from a study by, Peta Holmes or something like that. Sorry, I don't know what that says. So that's why the pituitary gland is important, because it releases that growth hormone. It's been shown to improve healing time in bone healing. Again, because of the growth hormone, we have the osteoblasts that have the GH receptors, and they can increase the bone mineralization. Fatigue, and decrease the fatigue that they'd found in one study. And they found that in their, when they used it on ACLs, there's been no adverse reactions. So I think it's pretty mind-blowing. I think it goes beyond just rehab. I think it was Tom had asked about it. It has made its way into our gym anyways. Again, it's not super sophisticated. They're just restricting the blood flow like these, like it almost looks like TheraBands, and they just wrap it around the arm, you know, so they have no clue how much they are restricting or not restricting. But I like it. I like it when new things come out and they're not like hugely contraindicated. I know that list seemed long, but in the grand scheme of things, like that's like minimal. So lots of good things. I'm looking forward to you guys being able to use this, and then hopefully next year's class can educate me a little bit more. But it's an exciting new topic, I think. So I hope you guys enjoyed this week. So like I said, it was a little bit different, but I know the lecture was a little more. Doing great. I like how the discussion boards are going. I'm getting more what I was searching after. I hope you guys are getting a lot out of them too. As always, if you have any questions, please don't hesitate to contact me, and hope you guys have a great weekend. Thanks.